One of the things that I want to emphasize before we end is that, to be quite honest, in every cancer, and so therefore in bladder cancer too, the patient has to be her own advocate, because oftentimes people don't discuss sexual issues, physicians, with their patients. So this study was done at Johns Hopkins with urologists who do bladder cancer care. They were surveyed about routinely providing any kind of sexual health conversations with their patients. And this is what they found. They found that as many as almost 21% of women never have that discussion about baseline sexuality, at the time of planning the surgery. I want you to notice the statistically significant difference between women and men. This is true not just in bladder cancer. This is also true, as I know, in heart disease, that there's the tendency to approach men about their sexuality much more so than women. And again, I think that there are cultural components. That may also be that until recently, most bladder cancer surgeons were men and maybe didn't feel comfortable to talk to women, but it's a problem. And, quite a good proportion don't discuss anything about the relationship. And here are the topics that are not covered. Sexual orientation, look at it. Only 25% of providers discuss sexual orientation for both men and women. Baseline sexual dysfunction assessment, look at that. As many as 61% don't assess it with women and 20% not with men. The partner sexual dysfunction, almost 80% don't discuss. Risk for post-operative sexual dysfunction. So that is really important for planning because, as Stephanie was saying earlier, these days there can be an effort to do some nerve sparing and maybe even organ sparing to protect sexual function. I mean, obviously cancer control comes first, but this is something that is considered. Well, if that conversation never takes place, the patient never knows that maybe there was a chance to do some nerve sparing, or if there isn't a chance to do nerve sparing, that they know why that was not possible. Mostly, providers don't offer referrals, and mostly, particularly with women, they don't discuss nerve sparing. So you can see that still today, you're less likely to get it from the provider than you should. And so that's why I'm saying it's really important for patients to be advocates for themselves. I was at a research conference at the American Urological Association last year in the spring about gaps in care for women with bladder cancer. And that was totally one of the topics there. Sexuality is not discussed, and it's a gap in care in general. So here are the barriers that the providers said they had. One was that they thought that if the patient is older, they don't discuss it, so they must think that people who are older don't have sex, which is not true, we know. Inadequate time to discuss, that I think is legitimate. Uncertain about patient's baseline sexual function, well, we have to measure it. Concerned that the patient would be uncomfortable. I think that the uncomfortable counseling patient or partner is probably the truer part, because most people will be comfortable if their provider is comfortable discussing it. Lack of knowledge of female sexual function, I think, is really also an important part. So there's a fair bit of education about how to talk to patients and also about female sexual function that urologists need to have early in their training so that they can have that conversation. So that was my presentation today. Thank you for your attention. And if there are any questions or comments, I would love to entertain them.
Thank you so much, Dr. Wittmann. This has been very informative. Please remember to submit your questions in the question and answer box that are there at the side of your screen. You just mentioned a couple slides ago that providers say that they don't make referrals, especially for women, more so than for men. So how do you recommend a patient bring this up with their provider and get a referral to either a pelvic floor physical therapist or a sexuality counselor or therapist that can help them work through some of the details with or without their partner?
So I would say that the best thing to do would be, number one, sit down to write down some questions. You know, how has this bladder cancer and the treatment for it affected my sexuality? You know, this is my experience. I now don't lubricate. I now don't feel any desire. I feel pain when I have intercourse, you know, any of those things. How has my cancer treatment affected that? Number one. Number two, who can be helpful with this? Do you know any sex therapists in the area? Does your hospital have pelvic floor rehabilitation specialists in physical therapy who can help me? And when those questions are set down, then sometimes it helps to let the urologist know that you're going to be asking those questions so that they can be prepared. It may just need an extra appointment. It's completely legitimate and reasonable to ask that. I think more and more urologists realize that they need to know who the sex therapists are in the area and that they need to have relationships with physical therapists who have this specialty, because really survivorship care is all about multiple disciplines. It's not only surveillance for the cancer, it's really quality of life. And so patients can definitely push the agenda. So setting down the questions and then letting the provider know that you're going to be asking.
Mm-hmm. And finding a sex therapist. Can you talk a little bit about how people can go and visit, like ASECT website? Maybe if you could spell that out for them and how they could look for somebody.
Absolutely. So there is this website of the American Association of Sexuality Educators, Counselors, and Therapists, asect.org. And maybe, you know, I should have really put it on a slide.
Sure, but we can spell it out. That would be great. Yep. A-S-E-C-T as in Thomas, .org.
And if you go to that website, there is a map of the United States. You click on your state, and you will get a list of all sex therapists in your area. Okay. It's alphabetical by city or town, or you will get a list of certified sex therapists in your area.
That's really
with all the contact
important
information. Mm-hmm.
Mm-hmm. And those are all people that are certified to do this. They've passed numerous rigorous exams. They know what they're talking about. You know, if you just did a Google search for a sex therapist, you could get all kinds of crazy things, and you could be susceptible to all sorts of weird emails. So please go to aasect.org if you are looking for a certified sex therapist. So this presentation is very informative. My issue is lack of desire. Hold on one second. Let me pull this up. And coupled with pain during sexual intercourse. So you didn't really address pain specifically, what patients would be able to do in the sense of helping with reducing pain from sexual intercourse. I know you talked about lubrication, you talked about a number of other things, but what about the pain that comes from the actual act of intercourse? This particular person's husband wants to have sex, and she says she's just not interested. Where does she start? If it's going to be painful, nobody wants to engage in that right off the top. That's definitely a barrier. So how do you address that?
So I think the first would be to go to a gynecologist and get an evaluation of the vagina. Because depending on the treatments, the vagina may be shorter, the vagina may be affected by radiation. So the gynecologist will look in and see what the vaginal walls look like, how possible it is to stretch the vagina, and that a gynecologist will then do a number of things. Maybe if the vagina, for example, is in fairly good shape, but the vaginal walls are fragile and dry, the gynecologist may recommend Vagifem, that medication that I mentioned. However, if there is scar tissue or shortened vagina, the gynecologist may suggest that the woman goes and sees a physical therapist to evaluate what and how much can be done to stretch the vagina and to make it more comfortable from the scar tissues to be able to have more comfortable vaginal intercourse. It may take time. Some of these exercises, some of these interventions can take time because the skin may take time to adjust and to adapt and to relax a little bit. I mean, I think there will probably be some cases where it's not possible, but I think it's always worth trying to get that assessment and then trying to get that assessment with a physical therapist to see how these interventions could help.
Great. Thank you. That's really useful information. So you mentioned that, again, sometimes it's the provider either making assumptions because a woman and or a man is older, they shouldn't be that interested in sex. Maybe that's part of what keeps them from talking about it. But how can patient advocates and patients themselves really sort of work to encourage surgeons and the urologists that are treating them with all the other types of intravesical treatments? How can they encourage these professionals to really begin to think about this topic? I know that it's addressed in medical education programs, and yet people still carry in their perceptions of older patients, maybe not needing sex so much. How do you bring that up to them?
So first, I would like to say that actually it's not very well addressed in medical education. People may get like a class in medical school, but it's not a part of clinical learning. Like if somebody's following a doctor in a clinic, medical student or resident, they're not hearing about it, so they don't think it's something that they should be discussing themselves. Mm-hmm. I think, a person has to be kind of very courageous and decide that they're going to be the ones who's going to educate the physician that even though they're 65, 70 years old, that sex is still important to them. It's important to their partner, and they need help. Now, I think one of the things that patients run across is that the physicians don't really have resources that they figured out. So they don't know who to refer to and how to provide those resources. So just by saying to a doctor that sexual health is really important to you and that you have this website and that you know about pelvic floor rehabilitation, the physician can send somebody to pelvic floor rehabilitation. They may not know much about it, but once the patient's gone there and if they get help, that physician will have learned that that patient got help with sexual health from a physical therapist or a sex therapist. So it's really kind of by doing. It's very challenging because, in most situations I have found that patients wish that provider would address it because they're not comfortable and, they don't even know whether it's legitimate to bring it up. But it is totally legitimate, and those patients who are willing to do that with their providers will really move that provider forward in their kind of maturity as a clinician.
That's a really excellent point. If a lot of people have a real anxiety about bringing up sexual topics, and especially admitting that they're even interested in some ways in sexuality. So think about if this is important to you and you bring it up, and then you report back your successes and how things might have improved or how you've adapted. You can educate all of these other providers as well that become more aware that this is in fact an issue. So, patients don't know what they don't know. They don't always know how to ask. how can we, include this information in terms of people who are newly diagnosed? When you're told you have cancer, your biggest concern is, I want that cancer out of my body. You don't think about what happened after the fact. If doctors aren't talking to patients about this preoperatively, how do you suggest? Obviously, BCAN is doing our bit to get the word out and let people know that this is an important factor that goes on with bladder cancer treatment. If patients don't know that this is an impact that they might experience, how do we work to inform them in general? Because people don't talk much about sexuality, as you mentioned early in your talk.
Well, I think the only way that we do it is that we do research and present it at scientific meetings to show physicians that this is really important to patients. We did a study on sexual concerns of breast cancer and prostate cancer patients at the University of Michigan and found that patients had on average 4 sexual concerns, and they generally were about concerns about how their body would function sexually, about how to satisfy a partner, and about being able to experience pleasure. So we know that patients are concerned. I think the only way to influence physicians is to have it be more of a part of their education, and then also presenting the research. On a day-to-day basis, I think BCAN is doing a great job in sort of publicizing the topic, and I think any physicians who go on the website also see it. And the other thing is, things like, I hate to put the burden on the patients. Well, I guess you're saying, what if the patient doesn't even know that this is a consequence? Right. I'm not quite sure how to make that happen. Because as you say, people are worried about their cancer, though I found that if you tell people that your sexual function is going to be affected, they may not want to discuss it right there and then, but they'll remember it later on that you were willing to discuss it with them, and they're glad that you're willing. I think it's education, disseminating information over and over again about this.
Well, we will continue. I'm sorry, go ahead.
Can I just mention one thing? At the Bladder Cancer, for women at the AOA last year, BCAN partnered with that too, didn't they? Didn't you guys?
We did.
We did. Yes, you did. I think one of the effective things was patient stories. And so if any patient was willing to put up a story on about this issue, maybe not sharing too many details, but how they were not informed and how that really hurt them later on, I think that would be powerful.
And we would welcome any additional stories. If you want to add your story to our website that has a variety of patient stories, we're always looking to expand those. And if you care to share about this, we don't have to put your name and we can put your information up, but please do reach out to BCAN